Hi, I'm Jean Sarnowski, and I'll be your host for the 7th episode of Cape Cod Health News, the news service of Cape Cod Healthcare. Today's show will be all about Falmouth Hospital. First, a little history. Falmouth Hospital opened May 2nd, 1963, with 58 beds, founded by a group of dedicated physicians and community members who recognized the need to have expert medical care close to home. Today, it's part of Cape Cod Healthcare and has grown in size to 95 medical surgical inpatient beds on 4 floors, yet has maintained its status as a community hospital. The Clarke Cancer Center was opened in 2011, making radiation therapy available to over 300 patients annually. Falmouth Hospital is supported by an expert medical staff with 54 primary care and pediatric physicians and more than 108 specialists. Over 90% of its medical staff is board certified. Falmouth Hospital has also become an important member of the team of specialists in Cape Cod Healthcare's Heart and Vascular Institute.
Dr. Zellman and I first met when we were in training together at the Brigham, and then a few years later he called with the idea of establishing a vascular center, especially here in Falmouth, but on all of Cape Cod, and as such recruiting vascular surgery to join the cardiovascular group. I was eager to come back to the Cape anyway, quite familiar with the Falmouth area, and very happy to work with a team put together really by Dr. Zellman and others, but a very good, talented, dedicated crew. Well, we're very excited to have Dr. Korepta here. She joined us a few months ago, and we first met her when she came on kind of a recruiting trip, and we brought her around the hospital and spent some time getting to know her. She has tremendous training in both open vascular surgery but also interventional vascular procedures.
So I grew up in Lenox, Massachusetts, and did all my training out in Michigan, where my parents are originally from. I went to the University of Michigan for my undergrad, Michigan State for my medical school, and then I stayed at Michigan State for my residency. I then moved back out east. I've always wanted to live out here, always wanted to come back to the Cape. Grew up coming out here for the summers and was very drawn to the community feeling here at Falmouth Hospital, so that's what drew me back to this area to take my full-time job. I met Jim Knox first when I interviewed here in Falmouth Hospital, and he's got to be one of the nicest, friendliest, most approachable vascular surgeons that I've ever met.
She's been great to work with. She's wonderful with the patients and the other physicians, and a hard worker and very talented, and we're really lucky to have her.
Well, here at Falmouth Hospital, the cardiac program is growing by leaps and bounds. I've seen it even since I've been here since October.
I think Falmouth Hospital really has become very advanced expert in multidisciplinary ways.
Now we're doing much more interventional peripheral work here in the cath lab and also in the operating room. We're hoping to continue to expand the program, doing endovascular aortic repairs as well as carotid endarterectomies and a peripheral bypass in the lower extremities.
She brings a lot of different perspective out of a very, very strong training program with a lot of newer techniques.
Minimally invasive techniques are very important for our patient population, especially out here on the Cape where we have an older demographic. It means people are able to return home and not have to go to a nursing facility for many of the minimally invasive procedures that we do perform. It also means less pain for them, which is less pain medications, much shorter hospital stays, and a lot of them are going home the next day after a minimally invasive operation.
We have the support of Interventional Radiology with Dr. Dombrowski and his team, and that has allowed us to do very advanced vascular work, both a combination of open surgery and interventional approaches that I think we've brought a lot of success and has been successful in large part based upon the other team members.
A lot of the endovascular aortic aneurysm repair that we're doing, they actually go home the next day. Most people are going home and they don't even require any rehab stay.
When we return, we'll learn about the newest husband-wife physician team in Falmouth.
Hi, my name is Ryan. I'm standing in the emergency department at the Falmouth Hospital. In 2017, there were 284 total knee replacements done at Falmouth Hospital. We have surgeons who specialize in foot, ankle, hand, shoulder, knee, elbow, and hip surgery. You can expect patient-centered care delivered by a team of physicians, nurses, and therapists specially trained in orthopedics.
At Cape Cod Healthcare, we're a team.
In every one of our 88 locations across the Cape,
you'll find people to care for you 24/7.
There are nearly 5,000 healthcare professionals
dedicated to you
and your community.
From Bourne to Provincetown,
Falmouth or Hyannis.
You'll have access to great care
wherever you are, whenever you need it.
Because we're not just a team.
We're Cape Cod's home team.
We
are Cape Cod Healthcare.
Hello, my name is Rich Weatherby, and I'm standing in the emergency department at Falmouth Hospital. Last year, the radiology department at Falmouth Hospital had 39,524 visits. Many of our radiologists are affiliated with the Brigham and Women's Hospital in Boston, which means we provide a level of skill more typically associated with a major academic medical center. You benefit from this team of highly trained specialists.
When Falmouth surgeon Jeffery Siegert and his wife cardiologist Megan Titas met at Emory University Medical School, it was, well, let's let them tell you about it.
I met Megan on the first day of medical school.
He introduced himself as having graduated from the Catholic University of America, which is a place I had never heard of.
We actually started to hang out when our best friend, a mutual best friend, decided to force us in a study group.
You know, from day one, we really had similar interests with sports.
Besides going to classes in med school, you also play a lot of ultimate frisbee.
We were both had grown up in the Southeast, I will say, and had both been transplanted myself from Cleveland, Ohio, him from New England area.
I actually grew up outside of Atlanta, and she grew up in Cleveland and South Carolina. So we were both from the South at that point.
Actually, in my class at Emory, we were one of the last classes before 9/11. That happened my first year of medical school.
We were actually on our way to anatomy class. We shared the same cadaver, as a matter of fact. Megan did internal medicine, and she was done 2 years before me. I did 5 years of general surgical residency. We did that at Boston University at the Boston Medical Center.
When I finished my training in internal medicine residency at Boston University, I was hoping to continue training with cardiovascular medicine fellowship. However, we were in a war, and the Navy said, "You're coming on active duty to provide skills as an internal medicine physician."
She started her Navy obligation for a couple of years while I finished my residency.
And one of the benefits of actually being in the Navy is that we did get to travel abroad.
So after our residency, we got on a plane to Japan. And it happened pretty much that fast. A couple days after I graduated, we got on a plane, and when we landed, it was like walking into a steam bath. And so that was our welcome to Okinawa. And we lived in Okinawa for 2 years.
So when we got orders to Okinawa, mine said Naval Hospital Okinawa, and his said 3rd Med Battalion, and we were unsure what this meant. However, we found out that he was on an operational billet assigned with the Marines. There are more Marines than Navy personnel in Okinawa. Navy medical personnel provide all care for the Marines, so he was deployed throughout Southeast Asia as part of a 3rd Med Battalion. A life experience that has been one of the best things that's ever happened to live in a culture that wasn't my own was living in Japan.
I was just planning on doing trauma surgery somewhere because a year after the chest surgery I had done a subspecialty in trauma critical care.
And at the time we were starting to interview for jobs, and it's always hard to get jobs for 2 physicians.
My wife is, much more competitive, I guess you'd say. I mean, people are always looking for her.
And Jeff had worked at Cape Cod Hospital as a trainee in general surgery during his 2nd year and his 4th year.
When my wife decided she was interested in coming down here, I reached out to an old mentor of mine, Dr. Spillane. But he also has a background like mine where we did military service, so he understands that component that I had to take some time to do that obligation and then come back afterwards, and he gets that.
So we were familiar with Hyannis area and the Cape, not so much Falmouth area.
And I had never been to Falmouth, so she really liked it a lot, and I said, let me go check it out. And
Since July was when we started work. We moved down in June.
I was actually sold. We went on the bike path down here, and I said, that's fine. We're coming here.
I love Falmouth. I love the quaint, I'd say, downtown area. There's multiple places where you can go out to eat.
So it's a nice community. I'm getting to know a lot of people. I enjoy having the scientific community around here. I think there's quite a bit of accountability when your neighbor is in the hospital and your neighbor's family is in the hospital looking to you. I mean, that's, you know, you're going to do a great job for them.
I love my job where you get to see people in clinic and form a relationship with them.
She's like the brains of the hospital, right? Because the cardiologists are some pretty intelligent people.
And then I like what cardiology offers, where I get to have a clinic-based practice. I get to go to the hospital to see acuity of issues.
There's a lot of stuff that I can cheat and just ask her real quick and not have to make, you know, a million phone calls.
I get to do some imaging with heart ultrasounds. I get to do stress testing.
We definitely, I guess, talk a little shop, but and it's good because she's not a surgeon and I'm not a cardiologist.
Well, it's good to be married to another physician because we have the same problem.
Thank you both for sharing your story. When we return, we'll stop in at the Seifer Women's Health and Imaging Center and learn about the latest innovations in breast imaging resulting in early detection and treatment for breast cancer.
Hi, my name is Sarah. I'm in the emergency department of Falmouth Hospital. Last year, 9,180 mammograms were performed at the Seifer Women's Health Imaging Center at Falmouth Hospital. Mammograms, MRIs, ultrasound, and now 3D mammography are used for early detection of breast cancer. Yearly screenings are important to identify any changes in breast health.
Cape Cod Healthcare has some of the most highly skilled physicians in the state.
Our hospitals are equipped with state-of-the-art technology.
Our patient care and support staff
are second to none.
We're accountable to you.
To you.
We're constantly innovating new techniques and procedures.
What we're really most proud of
are the little things we do for our patients every day.
It may be the big things that make us special,
but it's the little things that keep us connected.
We are Cape Cod Healthcare.
Hi, my name is Gail Marshall and I'm standing in the Falmouth Urgent Care Center on Route 28. Last year we had 32,578 visits. Urgent care is often your best choice for minor illnesses and injuries. For your convenience, we can do x-rays on site and care for minor injuries including lacerations.
Any woman will tell you that breast health is of utmost concern throughout her life. Breast cancer is the most common cancer in women in the United States. 1 in 8 women will be diagnosed with it in their lifetime. Seifer Women's Health and Imaging Center is taking a lead role in early detection of breast cancer, providing patient-centered care utilizing the latest imaging technologies.
My name is Chris Fitzgerald. I am a breast patient navigator here at Seifer Women's Imaging at Falmouth Hospital.
My name is Lara Bryan-Rest and we are in the Cipher Center at Falmouth Hospital.
Here at Falmouth Hospital, we screen patients on a yearly basis.
I'm Kathy Doherty and we're in my house in Falmouth. In January of 2015, I went into the Cipher Imaging Center at Falmouth Hospital and had a routine mammogram.
For a standard mammogram, we offer the 3D tomosynthesis now, which is the most up-to-date type of mammogram.
3D imaging, it's the same positioning, the same compression. What it does is takes multiple images through the breast so that we are able to see through the tissues, which is important.
They called me back, that was on a Saturday, they called me back a couple days later and said, we need to do some more images.
The thing I like about my job, about being a breast imager, is that I get to both interpret high-quality images and do high-quality medicine, but also get to have direct patient care. So I get to meet patients, talk with patients, and walk patients through difficult procedures.
I went in, they did a lot more images, and I knew then something was up, and they kept putting me in a holding room. Stay here for a few minutes, we'll let you know. And then they brought me in more images, and stay here for a few more minutes, I think you're gonna go home. I go, okay, and they came back, nope, you're having an ultrasound. They did the ultrasound right then and there, and then a radiologist came in and he told me, you have to have biopsies. He goes, there's something. There's definitely 2 areas both on the left breast that we see, and you have to go for biopsies.
So the role of our breast navigator is to help patients when they are, from the time that they are called back from screening. She reaches out to them to help them get scheduled to come back in for their additional exam.
I help to navigate patients through the women's imaging department from the moment they come in as screening patients through diagnostic imaging and biopsy.
It happened, I knew the woman that was performing the MRI. I know her husband's a customer of mine, so it was really nice. I knew her, and she gave me her home phone number, even said call me anytime. It was nice.
We can see any women anywhere from the ages of probably mid-30s all the way up to their 90s.
The Cipher Imaging Center at Falmouth Hospital is very convenient. Everybody there is awesome. They make you feel very comfortable. It was very relaxed. I didn't feel anxious or anything. Even the days I went back for the biopsies, I had to have 2 different sets of biopsies. They were awesome. Either Nancy or Christine was there, went with me the whole step of the way, held my hand, talked me through it, the whole thing. They were awesome.
Next door to the Seifer Women's Health and Imaging Center are the offices of Cape Obstetrics and Gynecology. Dr. Nisha David discussed with us the convenience to her patients in being located nearby.
I'm Dr. Nisha David. I'm a generalist OB/GYN here at Falmouth Hospital. In our practice, we have Dr. Elizabeth Murray, Dr. Paul DeMayo, myself, and then we have 2 nurse practitioners as well, and then we have a team of midwives that we work with as well. For people who are getting breast cancer screening, I've sent people right over and they're able to fit them right in and get the imaging done to kind of evaluate a mass or something like that.
It's been 3 years since the first diagnosis. I had 3 surgeries in 9 months, and I just went back about a month ago to the gym, finally, because tamoxifen makes you gain a lot of weight. So I'm just feeling really good though.
Whenever anyone asks me about going to Boston versus staying at Falmouth Hospital, I usually tell them that realistically we have all the same things here that they do have in Boston. We have great outcomes, we have the same talent in terms of the physicians and the nursing staff, we have all the same equipment, it's just close to home and there's a little less hassle when it comes to that. If there was ever a question that you needed some specialist, sure, that makes sense. You can go to see like someone who's super specialized in it, but pretty much there's all the same medical conditions can be treated here.
One of the things I really like about working at Falmouth Hospital is having come from a big, large academic center where sometimes the volume and the craziness patients can sometimes get lost in the shuffle. One of the things I like here is that patients really do get personal attention and they get one-on-one care, and that level of compassion shines through more than sometimes at big centers.
I mean, it's just great to be able to practice in a place where you live. It's really nice to be able to know that you're taking care of your neighbors and friends.
I would send everybody to Falmouth Hospital, the Cipher Imaging Center. Everybody there, I haven't run into one person that wasn't very compassionate, that wouldn't go the extra step. Nancy gave me her cell phone number and said, call me anytime. I mean, they went above and beyond, and I would send anybody there.
Hi, my name is Krista. I'm standing in the Urgent Care Center on Highway 28 in Falmouth. Last year, Falmouth Hospital saw 3,022 cardiac rehab visits. The Cardiac Rehab program provides a customized exercise plan, as well as classes on medication management, stress management, warning signs of future heart trouble, and dietary tips from a nutritionist.
At Cape Cod Healthcare, we all love our jobs.
We are always here when you need us.
24/7.
There are 88 locations across the Cape.
It's not just because of our cutting-edge technology
or the latest diagnostic tools.
We work in state-of-the-art facilities.
We have superior outcomes that bring you greater value.
Sure, all those things are great.
But the real reason we love our jobs
is because our patients are also our neighbors.
We are
Cape Cod Healthcare.
Hi, my name is Laura Robbins and I am standing in the Yaqui Emergency Center at Falmouth Hospital. Last year we had 33,244 visits. We have board-certified emergency medicine physicians, experienced nurses and staff, sophisticated testing labs, and the latest technology. And if your condition requires hospitalization, we can make a seamless transition to continue your care.
The Orthopedic Program at Falmouth Hospital, a cohesive team of skilled specialists Advanced technology and innovative treatment options make it feel like an academic medical center, but with the distinct advantages of a community hospital close to home.
I'm Stephanie Whalen. I am the nurse manager of the orthopedic floor at Falmouth Hospital.
My name is Jacqueline Ferrari. I'm a doctor of physical therapy at JML Care Center.
My name is Andrew Mish, and we're here at Falmouth Hospital Outpatient Physical Therapy Department.
I'm Erin Fayazzato. I am an occupational therapist working with the visiting nurses.
We at Falmouth Hospital take great care of total joint replacement patients in the community. We provide care for total joints including knees, hips, and shoulders. In doing so, we provide a thorough collaborative approach to patient care by offering preoperative education, post-operative education, and a real continuum of care throughout the whole process.
Okay, my name is Michael Montero. I'm from Falmouth, born and raised there, yeah. I had a total hip replacement on my left leg.
How'd it go?
Well, it's right now seems to be going great. I had PT this morning, and it's really going well.
We took a look at how we could provide overall care for all our patients, again involving our preoperative employees and getting all patients in to feel comfortable coming to us. We provide the education beforehand so that we're giving them all the information they need to really feel comfortable.
We had a class that we had to take before the surgery.
So we need to kind of be in control, I don't want to say in control, but understanding of what you're taking, so we need to kind of manage that while you're here.
And it was done approximately 2 weeks before the surgery was actually done. In the class, they focused on what we could expect.
We have orthopedic nurses who do an exceptional job taking care of this population of patients, as well as a dedicated physical therapy team that works inpatient as well as our outpatient physical therapy department.
When I see patients coming in to physical therapy here at the outpatient clinic, it's usually after they've, of course, had their surgery and then had some either home care or had some therapy at a skilled facility like JML.
When patients come from the hospital to the VNA services, we have, within 24 hours, we go out to see the patient.
JML stands for Josephine, Mo, and Lily, and it's a short-term rehab, or SNF as it's also referred to, a skilled nursing facility.
First and foremost, our main goal for the patient is their safety. Their safety, their mobility in the home.
Typically, our orthopedic patients spend 7 to 10 days here at JML.
Patients, when they see me, it can vary anywhere from several weeks to as many as 6 to 8 weeks, depending on the orthopedic procedure that they've had.
We have a fantastic orthopedic team that provides care to our patients. We have a great team of surgeons who work with our patients preoperatively and throughout their entire stay with us.
So we try to cater to each individual and, of course, their needs.
I love my job. I come in and I feel like I'm making a difference, and working with such an exceptional group of nurses and physicians and physical therapists, the whole team. It's a very collaborative approach to care, and I feel lucky to be part of a team that cares as much about the patients that we're seeing every day.
Falmouth Hospital is unique. The community is close-knit, and many of the employees have likened it to a family atmosphere.
I love Falmouth. It's a nice sense of community. It's a smaller town with access to the big city. Boston's close if we need it.
I like being in Falmouth because it's a close-knit community.
We do have a very community feel here. Everybody seems to know everybody, which is a fantastic thing.
We have everything that we need down here on the Cape.
What I like about Falmouth is all the great people that I've been meeting as I've lived here, and of course the beaches and the forest lands. I try and get out in the woods as often as possible with my wife and kids and dog.
You can enjoy the science community in Woods Hole.
I love the beaches, I love the shopping.
It's a really cute town. I like that in the summer there's just a lot of, it's just very lively.
You truly have everything that you need here as far as entertainment.
I chose Falmouth Hospital because I thought it would be great to work at a community hospital that, serves the local area and people who live here, and I've heard great things about it.
Got all the shops open, there's great restaurants, there's a lot of things to do, there's a lot of great outdoor stuff. It's a great place to have kids.
Falmouth Hospital has been a great place to work, it really truly has.
By the beach, by the water.
We pride ourselves in our community.
I look forward to a nice full summer, maybe having some neighbors let us go on their boats or something.
Thank you for tuning in. You can learn more about Falmouth Hospital by going to our website, capecodhealth.org. I'm Jean Sarnoski, wishing you good health and great health care.